Got to talk about COVID-19 and coronavirus and the dramatic response by hospital systems throughout the country. Here in the New York City area, the largest hospital system is the Northwell Health system, and the CEO and president, Michael Dowling, is joining us now because there's a great deal that your system and your 45,000 plus employees are doing. We want to let everybody know that you have announced those 45,000 employees are eligible for bonus pay of $2,500, as well as an extra week of vacation if they're on the front lines. I've got to imagine this is being received well by your staff. Can you unmute, please? I think you have to press *6 to unmute if you're on your phone. Anjali Kamlani is also joining us. We're going to try and get his shot unmuted. But Anjali, there we go. Go ahead, sir. How is the staff reacting?
The staff has been reacting beautifully, very, very positive. The 45,000 that you mentioned are the people on the front lines. Our total staff complement for the health system is about 73,000. But this is basically a demonstration of our gratitude to the staff that have been out doing heroic work over the last number of weeks. And we've had over, up to this point, 11,000 COVID cases in our hospitals. So this is basically to say to the staff, we thank you, we respect what you've done. And so far, what you would expect, it's been overwhelmingly positive.
Michael, thanks so much for joining us. Anjali here. One of the things that I know that you've done is start to print 3D swabs. And so that's one of the things that we know that you've been dealing with when it comes to shortage of medical supplies across the board. And we also know the federal government has announced things like a partnership with U.S. Cotton to get more swabs out there. As we're going into talks of reopening and reducing the burden on you right now, what does that look like? Do you feel like this is helping? Tell us about what medical supplies are like right now.
Right now, we're okay with medical supplies. Obviously, we burn about, for example, with masks, we burn about 10,000 a day. That's our burn rate. So, that's 70,000 a week. And, similarly with gowns and other things like that. So you've always got to have a large inventory because you don't want to be in a situation of being a couple of days out without having the supplies. So we have been helped dramatically by the state of New York. Obviously, the federal government has been helping. And so we've not had that predicament in any major way. And right now, we're in a good position. One point that's important to point out here is that as we reopen, we will continue to need even more masks and PPE because we still have cases in the hospital. Today, we have 2,500 cases in the hospital. As we reopen over the next month or two, and those plans have not been defined yet, but you will then need more PPE as that happens. So it's not like when we stop to reopen, we don't need those. We will actually need more.
Absolutely. And one of the things I know that the governor really made you guys do is work together like one large statewide hospital system. Right. Has this made you rethink in any way operations and going forward once we're out of the outbreak? There was a lot of concern about rural hospitals and competition in general in the healthcare space. What has this done to change your perception?
Well, I think there's a couple of points here. One is that we have been cooperating in a major way over the last number of weeks, and that's amazingly positive. And that cooperation is great because in an emergency, you cooperate, you collaborate, you do things together. That does not mean that we don't compete. So as this goes away, we will compete. But I do think there are things around cooperation that we have been doing that may very well continue. I happen to be a believer in competition. I think competition makes you better. If you compete, you're going to get better and better. It's like any scenario that you can imagine. It's like sports. If you compete against the best, you get better. So while we will continue to cooperate, I do believe that we will also over time continue to compete. It's not one against the other. I think it's a combination of both. But the process of cooperation during this past couple of weeks has been enormously successful. And I assume that there will be more of it going forward while we compete at the same time.
Michael, it's Julie here. I wanted to take a step back and ask about where we are in this pandemic. Right. As we said, you all have 23 hospitals, 665 outpatient centers. Sure. We've been hearing from Governor Cuomo that hospitalizations have started to go down.
Right.
What are you seeing on the ground, and do you think we're indeed sort of past the peak here?
I think, being cautiously optimistic, I think we're past the peak. We've seen a reduction in cases each day for the past 7 or 8 days. Small decreases, but I think we're on the downward slope. That will continue for quite a while. We're not out of the woods, and you have to be very, very careful that you could, and to understand that you could still get a blip in the other direction. But the stats right now indicate that we're moving in the right direction. We will have COVID patients with us for a long time. It's not like that this will disappear. We will still have COVID patients, varying numbers, until we get to a point next year sometime when there's there's a drug out there that can actually provide some kind of element of security and cure. But we're going to have it for quite a bit of time.
Michael, it's interesting to talk about that because the CDC director, Dr. Robert Redfield, just said yesterday there's a possibility that the assault of the virus on our nation next winter will actually be even more difficult than the one we just went through. I should point out, though, President Trump has ordered him to issue a statement. The Twitter-in-chief is requesting that they walk back, I guess, what the CDC said. What would you say about that?
Well, I would believe the CDC. You have Dr. Fauci is a very renowned individual. We all hope that we don't see it coming back in any major way in the fall. I mean, we don't want to go through this again, but you've always got to hold open the possibility that that might happen. So our emergency planning is not stopping. We actually are putting in place right now emergency plans for the possibility of this reactivating again in the fall. We hope not. And we're planning that it won't, and we're planning that it might. And that's the way you have to address those. But I would tend to pay much more attention to Dr. Fauci than I do to certain politicians in this regard.
Michael, one of the things that the politicians have been doing is talking about immigration right now. I know that affects residency programs. So you're looking at new doctors coming in and the important role that they've played on the front line as well throughout this outbreak. What are your concerns about the immigration policy right now?
Well, you don't want to cut off, talented people that come into this country that are here at the moment and that are at a nervous situation about their circumstance might be. People from other countries that have been here. I, by the way, I'm an immigrant. I came from overseas, as you can probably tell by my accent. So actually, I'm very pro-immigration. In fact, if you're American, you've got to be pro-immigration because that's what America is. It's the combination of immigrants coming together in this great place. So I look with askance and have some criticism with broad-based statements about the fact that you want to reduce immigration, curtail immigration, et cetera, without a thought process behind it that really answers the question, what are you really trying to accomplish? In our healthcare arena here, we have many staff from overseas, many staff with visas from overseas, working in our research centers, working on the front lines, providing heroic service on behalf of Americans. And I think we've just got to be very, very careful we don't diminish that supply of talent.
And we should point out, when you talk about frontline workers and boosting them with bonus pay, it's not just nurses and doctors. You're talking about the housekeepers and the staff at the hospital who keep everybody safe. Thank you so much for joining us. We appreciate your being here. Michael Dowling, Northwell Health CEO and President. All the best to you and your 70,000 plus employees who are doing their best in this crisis.
Hey investors, Zach Guzman here. Are you interested in learning more about the markets and getting the latest financial news? Well, then click right here to subscribe to our Yahoo Finance YouTube channel. Get the latest up-to-the-minute market analysis, big interviews in the world of finance, and information on how to manage your money every day wherever you are.